The topic of this presentation is the use of taste aversion therapy to treat alcoholism. The experiment was taste aversion therapy with alcoholics, techniques and evidence of a conditioned response, conducted by Timothy B. Baker and Dale S. Cannon, and published in Behavior Research and Therapy, Volume 17, Issue 3, in 1979. The reason this article is the most relevant one to the topic of taste aversion therapy for treating alcoholism is because it documents one of the first instances where chemical aversion therapy was tested as a means of treating alcoholism. It also records the subject's behavior towards alcohol up to 6 months after the experiment. The reason for this experiment was finding the most effective aversion therapy for alcoholics since electric shock therapy, which proved to be mostly ineffective. The aim was to discover a safe, easily standardized taste aversion therapy technique that would be effective in treating alcoholism by eliciting a conditioned response, such as nausea, to the taste of alcohol. The hypothesis was that taste aversion therapy used in the experiment would be more effective in treating alcoholism than electric shock therapy. This is based on discouraging results in experiments involving treating alcoholism with electric shock therapy. On the other hand, evidence gathered from non-experimental reports indicated potentially encouraging results could come from using chemical taste aversion therapy. The subject in Experiment 1 was a 28-year-old male with a 5-year history of alcoholism. The subject self-reported a range of alcohol-related issues, including a period of hospitalization and multiple charges of drink driving. The subject in Experiment 2 was a 29-year-old male that self-reported having been drinking since before he was 16 and had a serious problem with alcohol for 3 to 5 years. Along with chemical taste aversion therapy, the subjects would also receive the inpatient regimen, which included group therapy and alcohol education. In the experiments, 3 non-alcoholic flavors, cola, lemon lime, and water, and the participants' favorite drinks, port wine, beer, and vodka for subject 1, and beer and bourbon for subject 2, were administered to them. The flavors were given in random order by way of squirts into their mouth using a syringe. Their responses to these flavors were recorded using physiological measures such as skin conductance response and heart rate response. In addition to the subject's self-reported responses, the experiment consisted of 5 conditioning sessions. The subjects were given syrup of ipecac, an oral emetic. Immediately after ingesting the emetic, they were given their favorite liquor to ensure the taste association would be formed between the alcohol and the onset of illness. In Experiment 1, the subject threw up 17 to 29 times during and after the session. The sessions produced significant changes in physiological responses, including increased heart rate and skin conductance, indicating the sessions produced a stress response in the subject's body. After the experiment, the subject drank significantly less alcohol. He abstained from alcohol for 3 months after the experiment. In the following 4 months, the amount he drank was significantly less than he did before the experiment. In the 2 months after that, the subject went on a 7-day drinking binge, but discontinued without medical assistance and stopped drinking alcohol completely again. The results of experiments 1 and 2 were the strongest validation at the time that chemical taste aversion therapy could create a conditioned response to drinking alcohol. However, more research was required to validate whether there was a relationship between the conditioned response to alcohol and the probability of resuming alcoholism after the taste aversion therapy. The experiment does not distinguish what results came from the chemical taste aversion therapy and what results were due to the inpatient regimen. Both of the subjects were the same sex and around the same age, making the results of these experiments more difficult to apply to the general population.